All right. I think I'm working. It just, you know what? It was just part of the day. It's how the day started. Oh, I thought I was missing an earring there. How the day started, and it's just gonna keep on going. So, which one do I need? Okay. Let me know if you're having on with me. Oh my gosh, y'all. Okay. So I'm in a couple groups. So let me know if you see this, if it's live. I went to hop on and I had checked everything. And of course, camera and mic weren't working. So nothing was going to work, no matter if I tried doing it from anywhere. But I think I am live now. I think it should be working. I would love to know. Tell me, first of all, where are you joining me from? Where are you joining? It's Friday. It's the weekend. Hopefully, if you're joining, you are also off work. So let me know where you're joining from. The other thing I want to know is, because we're going to be talking about vitamin E, I would love to know, maybe you saw a post that I did earlier and you checked your labels. I'd love to know what your labels said. Do you know what source your vitamin E is coming from? That's just going to give me an idea. And if you don't, no big deal. And if you're not somewhere where you can, hey, Heather, if you're not somewhere where you can go check a label, not a big deal either. I will encourage you after this presentation to go check your labels, and you'll see why there. So we're going to go ahead and get started. I just realized I was making sourdough. I was making bread today and I didn't put my rings back on, and I hate that feeling. I hate that feeling. Okay. I'm going to end up like playing with it. Okay. Hi, Jenny. Oh, couple from Minnesota. Couple from Minnesota. All right. So I'm going to go right ahead. And so let me tell you. So in case we've got anyone that's joining in that may not know me, so you can see on the screen, Dr. Liz Scott. I am a doctor of neurologic physical therapy. I have my board certified specialization in neurologic rehab. I had been in the clinic for a little over 10 years. I am now a homesteading, homeschooling mama of three. I live in central Illinois. And what I'm coming at you with is a review of the research that I have personally done into the. Today, we're going to talk specifically about vitamin E, but my feature Fridays are always about something that I have done the research on my own. And I'm here to give you advice. I'm not here to heal, cure, treat, diagnose. I am not your doctor. So please, any of the information that I give, make sure that if you have, really in-depth questions, if you're on medications, if you want to know about interactions, yes, I can take a look. But again, I am not your doctor. So I do recommend that you ask your doctor, you bring those things to your doctor so that you can get the best information for you as an individual. But I hope to that by bringing this information to you, it plants seeds. It makes you think a new thought. I love questions. I love questions. I do not know it all. And by you asking me questions, I can go and look further. I will bring anything else to you that I find, and it makes me continue to dive deeper and widen and broaden the information that I'm getting. This is I really need a better background. I really do. But this is our homeschool classroom. It's actually a bonus room off of our pole barn garage, and it's a mess. But such is life. It's real life around here, always and everywhere. Okay, so what we're going to go ahead and do, if you are joining and you're asking questions and you're commenting, if you have not given StreamYard permission, all I see is something user. So depending on where you're joining me from, so just make sure to drop your name in there if you are going to ask a question so I can address you directly. I love to do that. I love to make sure that I am addressing any questions that come along through the presentation. So what I'm going to go ahead and do is add my slides to the stream, and we're going to go ahead and get started. So vitamin E, I'm going to do an overview today. And this was something that was very interesting to me. Vitamin E was not really on my radar until about 2 years ago. I'd heard about it. Tell me, let me know in the comments if you're here watching live. I know we've got a few people watching live. Are you taking a vitamin E supplement? And what do you know of in regards to vitamin E as what it can help with? Like, why are you taking it if you're taking it? So I knew about it as like the vitamin E creams for like scar healing. That was the extent of what I remember, which is probably a detriment to my, well, I wasn't as big into the nutrition back then. Let's just say that, okay? Yes, I am still drinking coffee. It's 4:30. I usually don't. It's been a week. That's all I'm gonna say. Okay. So, oh, my picture isn't coming through. Okay, so there was another picture here that I'm because where you're gonna the information you're gonna get from here is both from books that I have read that I'm synthesizing the information as well as research articles, and that's what's missing here is a number of research articles, reviews. So not individual, but reviews of the use of vitamin E. And today we're gonna focus on the difference between tocotrienol vitamin E and tocopherol. So that's where I'm taking for cellular health. So important for us that, yes, absolutely. Cellular health is going to be a big thing. You're going to hear me say a lot about that today. So vitamin E is actually a family of 8 separate but related molecules. You have 2 main categories. You have tocopherol and you have tocotrienol. Each of those has 4 subtypes, delta, gamma, alpha, and beta. And that's important. The majority of what is out there, what we knew for like the last 100 years, was based all around alpha tocopherol. But what they are finding is that delta tocotrienol and gamma, but delta first, is more potent and maybe better in disease prevention. And so that's where I'm coming from is what can we do to reduce those chronic illnesses and prevent them, as well as what can we do to combat them if they've already developed. Okay. So tocopherol was first discovered, like I said, almost 100 years ago. It was named vitamin E. It was actually discovered because of fetal development. So that's where it got its name. However, the clinical studies that have been done in the last like 20, 30 years show that tocotrienols, now important here, when combined with a healthy lifestyle, and we're going to talk about the specific dietary needs, they can do incredible things, including lower lipids, reduce inflammation, protect the liver, promote bone health, kill cancer cells, increase survival in cancer patients. Some really big things. The wrong form of vitamin E, however, can actually hinder the body's ability to absorb the tocotrienol. And when I say wrong form, it's the tocopherol. So the balance between tocopherols and tocotrienols is actually very important, especially in our diet. So the history of it, if we're just looking at a general history of vitamin E, in 1922, so literally 100 years ago, right? We're in 2022. Yeah, we're we're in 2022. 1922, it was discovered for the importance in fetal growth and development. Then research continued. We found the antioxidant properties of it. Tocotrienol was first discovered in 1964. In the 1980s and 1990s, more research, more discoveries started happening. It wasn't until 2003 that the first annatto tocotrienol product was on the market for sale. And then in 2019, and since then, what you will see if you were to go to one of the books that I showed in the beginning is that the level of research on tocotrienols has now outweighed the research being done on tocopherols because of its potency and its ability to prevent more than the tocopherols. And I'll get more into that. So there's 3 major sources of tocotrienols. There are more. The biggest, and I'm going to show you the breakdown of this, is rice, palm, and annatto. The difference, though, is in the types. So I talked about those 4 subtypes. It's in the types of tocotrienol that is in each. Okay, so rice contains mostly gamma and gamma and alpha, but little delta and beta. Palm was really known for its high content of carotenes. It has high amounts of alpha tocopherol, okay, as well as the tocotrienols. But what we're going to find is that those alpha tocopherols can actually inhibit the body's ability to absorb the beneficial effects of the tocotrienols. And it depends on your balance. And then annatto, which was discovered in the 1990s, only has delta and gamma. And those are the two subtypes of tocotrienols that have been found to be the most potent and the best for prevention. So the most potent of the four forms is the delta and gamma, then followed by alpha, and then last is beta when it comes to the potency. So this is a look, I like the pie graph. I like the visual of this. So a natto has all, and what you'll see is that it has all delta and gamma. I actually don't know when I do that. I feel like you guys can see my cursor, but now I realize this is streaming and you probably can't. So not going to do that anymore. So it has 100% delta and gamma, the most potent subtypes of the tocotrienol. Palm has 50% delta and gamma, very good, but it also has some alpha and beta, and it also has some tocopherol. So you've got to be careful in the balance. And then rice, the rice bran oil, and rice in itself has more of the tocopherol. It's 50-50 as far as tocopherols and tocotrienols, but it's 50% tocopherol and then the least amount of the delta and gamma tocotrienol, and that will become important as I keep going. So Delta Gold was one of the products released to the market and has a unique has a patent on how they extract the delta subset of the tocotrienol. So this is specifically from the book, The Truth About Vitamin E from Dr. Barry Tan. He created American River Nutrition, develops the first ever tocopherol free. So why do I say that? Okay. Palm and rice, yes, have tocotrienol. However, they also have the tocopherol. And what the research shows is that tocopherol can inhibit. So by having a product that has no tocopherols and is exclusively tocotrienol, you're going to get the maximum pharmacological therapeutic benefit from it. So that's important that it was tocopherol free. Then in 2002, Dr. Barry Tan and his company was awarded the first ever annatto patent for the extraction technique. So what they do is they extract the delta and gamma tocotrienols from the annatto plant, which is okay. And they do that without using, I've got a little bit of notes over here if you see me looking. They do that without using any harsh or synthetic chemicals, any petrochemicals, or any solvents. So it's a physical and evaporative technique, making it 100% natural. And that's, again, your source and how it's extracted are super important. And then in 2005, Delta Gold was first released for sale to consumers. So let's talk a little bit about the action that's happening in the body. So tocotrienols are going to be found in the cell membranes, and they are helping to maintain the integrity to protect the cell. You need to know these terms. A free radical is an overcharged oxygen molecule that has become unstable. So free radicals are created in the body secondary to stress, pollutants, smoking, bad foods, excessive exposure to UV rays. Most importantly, though, is that word stress. Okay, high stress leads to increase in free radicals in the body. Not good. Okay, and then a damaged cell, or one that is deficient in vitamin E in the cell membrane, can actually lead to premature aging and disease. And if you are deficient in vitamin E, there's going to be a deficiency in your cell membranes. This can actually have a negative impact on the function of your T cells and your B cells, which are part of your immune system. So it can actually negatively impact the function of your immunity and your immune efficiency as well. Okay, next. So antioxidants. Vitamin E is one of many antioxidants. You can see the list on the screen of the other antioxidants. An antioxidant removes that unstable oxygen, okay? So that free radical, that overcharged oxygen molecule that's going around destroying everything in your body, an antioxidant will remove that unstable oxygen and protect the cell membrane. So it actually is like scavenging around your cells, around the lining of your cells, to fight off those free radicals. But if there's not enough fighting, then these free radicals can enter the cell, and that's what damages the cell and allows bad things in. That's the simplest way of putting it. The other antioxidant that's actually not listed here, I didn't get a chance to update this, are some of the B vitamins. So B1, B2, B3, also known as thiamine, riboflavin, and niacin, as well as there are some minerals, and you'll see these here, the selenium and the magnesium, which is not there. Selenium and magnesium actually are minerals that help to activate enzymes that help in the creation of the antioxidant. So it's all a big system, all works together. All right. So vitamin E in and of itself, vitamin E meaning all 8, tocopherol, tocotrienol, all the subtypes, is a fat-soluble vitamin. So we talked about the fact that it works best with a healthy lifestyle and a healthy diet. In order for your body to absorb the vitamin E, if you are taking it as a supplement or if you're getting it in your diet, you have to also be balancing it with healthy fats and lipids. This will help your cell actually absorb the tocotrienols so it can be stored and used for future use. The other important component, though, is that our bodies, all the tocotrienol form of vitamin E can actually be free floating as well, and that's where it gets some of its anti-cancer benefits. So currently the most popular in nutrition and where you'll find it the most is alpha tocopherol. But what the newest research is finding is that not only is it not as good, but it may actually have harmful effects in certain doses. Tocotrienol form of vitamin E is 40 to 60 times more potent than the tocopherols and more effective at cell protection. The alpha tocopherol in excess can impede the cell's ability from absorbing the tocotrienols and also impede it from being in the bloodstream and doing its job to fight off the free radicals in the free floating form. So structurally, there is a big difference. What you're going to see on top is the tocotrienol, on bottom is the tocopherol. I'm not going to get too deep into this, but I'm just going to talk about the fact that the tocotrienol is unsaturated, which is what helps it grasp on better and protect, whereas the tocopherol is a saturated, okay? And then the heads are different sizes, meaning that they move differently in the cell wall. The tocotrienol can move faster, so when it's scavenging, it can get to that free radical much quicker than a tocopherol molecule can. So the shorter tails, the smaller heads, I talked about both of those, and specifically the delta tocotrienol has the smallest head of all the 4 different subtypes of tocotrienol. This allows them to squeeze into parts of the cell easier than the tocopherols and gives them increased access to the cell membrane. And then I talked about that unsaturated tail of the tocotrienol, giving them higher bioavailability and allowing them to kill the cancer cells. There was a study done, I'll touch on this real quick. There was a study done on vitamin E and selenium and its ability to have anti-cancer, specifically in prostate cancer. But what they found is that it wasn't preventing it. It could help once you were diagnosed in prolonging the duration of life after diagnosis, but it wasn't doing its job in preventing. And then that led to additional research. And now they're looking at tocotrienols as preventative measures, and the effectiveness of it is in its ability to prevent. And there's much more promising research in that field. Okay, so overall benefits and functions of tocotrienols is a lot. And that's why I feel it's so important that if you are supplementing with vitamin E, or if you never have, and you're wondering if you should, I want you to take a look at this list. If you're someone that struggles or has been diagnosed with a deficiency in anything on this list, healthy brain, healthy blood sugar, just cellular health, cardiovascular and cholesterol levels, metabolic and liver maladies, health, your bones, if you've ever been exposed to radiation, if you know that you have inflammation, and it upgrades all cells and their lipid antioxidant protection. So if any of that speaks to you or someone you know, this may be a beneficial thing. And again, we're going to talk about annatto, getting that, you can get that in your diet. I personally wasn't eating annatto regularly. So that's something, again, you got to be careful of your sourcing. And then we also talked about some of the other sources from a dietary standpoint. But if you're not eating the things that have the tocotrienols, then supplementation may be beneficial as well. So conditions that tocotrienols help manage, kind of branching off of that first slide: chronic inflammation, high cholesterol, cardiovascular disease, metabolic syndrome, non-alcoholic fatty liver disease, diabetes and prediabetes, cancer, bone health, Alzheimer's disease, stroke. Holy moly, and the number of things and how prevalent these are right now throughout the world at a much higher level than they ever have been. And then additionally, arthritis, eye health, immune system, skin health, and radiation poisoning. So in order to maximize the benefit that you would get from a vitamin E tocotrienol supplement, or if you're eating it in your food, a normal healthy person should be getting 100 to 200 milligrams of tocotrienol per day, and it is safe in the upwards range of 600 to 1,000. If you are someone that has one of those chronic conditions I previously mentioned, if it is a mild chronic condition, you're going to want to increase that base level to 300 to 450 milligrams. And if it's an advanced chronic condition, you're going to want to increase it even further to 450 to 600 milligrams. It is best consumed with a meal because it is fat soluble, and ideally a meal with some healthy fat in it. Okay. Supplementing alpha tocopherol. So if your alpha tocopherol intake is more than 15% of your total vitamin E intake, you can interfere with your body's ability to absorb the tocotrienols in general. So 85% tocotrienol, 15%, and I'd say, you want to go high and low, right? 90%, 10%, something like that. So you really want to be looking at that balance, which is why I said, have you checked your labels? Tocotrienols will enhance your diet. They are not intended to replace your regular whole food intake of antioxidants. Food first. Okay? healthy, homegrown, non-GMO, non-modified, from the earth, in the way God designed it to be, antioxidant food. That's my personal soapbox on that. A vitamin E tocotrienol supplement will be shelf stable at room temperature for up to 3 years. So just knowing that, if you've got that on the shelf. So if you want to, this is specifically from Dr. Barry Tan's book, The Truth About Vitamin E, and the use of Delta Gold. Now remember, Delta Gold is the delta and gamma tocotrienols. It's the patented extraction process from the annatto plant, tocopherol free. When taking a supplement that includes the Delta Gold, okay, the first thing he talks about is where are you going to get it from food? You're going to get it from fish, kale, carrots, oatmeal, nutritious cereals, citrus fruits, and dairy. Then, if you have one of these conditions that we've talked about previously that it helps with, inflammation, high lipids, arthritis, cancer, it goes through and it talks about what's the tocotrienol dosage. So you got to look at both what are you getting from a supplement standpoint, as well as what are you getting from your diet. And that's sometimes hard to do. But in order to maximize the benefit of the tocotrienol, you would also want to make sure that you are taking in these. And I love this chart. I love the combination of, if I have this diagnosis, I need this as well in order to bring me back to optimal function. Okay. I'm not going to read through these. If you would like these charts, comment chart for me. I'll put the charts in the comments wherever I see that. So if you would like a copy of these charts, let me know. I'm happy to copy the charts down. This is just a continuation of that chart: cardiovascular disease and metabolic syndrome, eye health, immune system, bone health, Alzheimer's, brain health. Some of these don't have a daily recommendation. They know that it helps, but they don't have a recommendation as to how much these certain conditions should be taking. So then I would go back to that slide that we talked about where it said that 100 to 200 if you're normal healthy, if you're mild chronic. So if your eye disease has been mild chronic, you're going to be a little higher. If your eye disease has been severe chronic, you're going to be even higher. That's your baseline. And then you want to combine that with, let's say, lutein, zeaxanthin, which is actually from marigold, omega, vitamin A, C, zinc, that kind of thing. So another thing to consider with any type of tocotrienol supplementation is that you should really only be doing a maximum of 300 milligrams per meal. So if you're someone who's recommended, such as on this slide, because of radiation damage or non-alcoholic fatty liver disease at the 600 milligrams, you're going to want to space out your tocotrienol supplementation over a couple of meals. Okay. So before I move on, I believe I'm almost at the end here. Yes, I am. Okay. Does anyone have any questions? Anyone that's on, anyone watching live, anyone have any specific questions that I can answer? And then the last thing I'm going to do is there was a really wonderful review done on pharmacological potential of tocotrienols. With today, I just didn't get it into a slide format, so I'm just going to go over it. But if anyone has any questions, I'm going to wait about 30 seconds for that. And then I'm going to end with just going over this. I don't want to. Here we go. All right. Not seeing any come through. Okay, so real quick. So this is this is a pharmacological. This was done in 2014. So 8 years ago. There's newer research, but I liked it because it was a review. So it synthesized a bunch of things. Basically, what this one, this is where it talked about the selenium and vitamin E was a trial called Select. What they found was that the formulations used in Select were not able to prevent, and there was concern in the development of type 2 diabetes. The form of vitamin E used in that specific study was the alpha tocopherol. So as I said in the beginning, one of the concerns is that alpha tocopherol was designed for fetal development and then continued because of the antioxidant properties. It was continuing to be recommended for many other things. But what they're now finding is that the different subtypes are actually very important, and it may not be the best and could be detrimental to health, which is why the tocotrienol research has taken off. So that was a big thing that I found. It does, this again goes into saying the antioxidant, analgesic, anti-inflammatory, antibacterial, antipyretic, antithrombotic, anti-cancer, cardioprotective, liver protective, hypoglycemic, kidney protective, all of the things. And this is specifically to the tocotrienols. The tocotrienols not only suppress cancer cell proliferation, cancer cell copying, but also kills. So it kills the cancer cells. And that was specifically, I want to make sure I'm saying, the gamma and the delta. So again, that delta gold would be best in the sense of cancer killing. It was also, there's also a research done on breast cancer. It was more about the toxicity in the drugs used to treat breast cancer and the vitamin E's ability to combat that toxicity due to its antioxidant protection. So that was specifically, tocopherols have failed to offer that protection, but tocotrienols, specifically the alpha and delta, in alone and in combination, had the anti-cancer properties. So that was an amazing finding. I know, unfortunately, I have personally known a number of people recently diagnosed with breast cancer. So just knowing that there's some of these natural methods out there, these natural products, you can find them in your diet, like I said, but there's also really amazing supplements that have this specifically. And I know that Heather had commented here, Renew, which is now Radiant, or was it Radiant and is now Renew? Oh, darn. Anyway, it's Renew. It's now Renew. Okay. Is a Delta Gold tocotrienol. It also is combined with something called GG. GG has been studied, and I'm just going to do a short stint on this, but GG has been studied in its ability to combat the negative side effects of statins. So you take the tocotrienol cardiovascular health protection properties, you combine that with another substance that's been studied in combating the negative side effects of the most commonly prescribed thing for cardiovascular health, which is a statin, and now you've got a really potent cellular protection, anti-metabolic syndrome product. So that's something too. I'm not going to go too deep into that. If you have questions, please leave them in the comments. If you found this helpful, I'd love for you to invite people to the group that you watch this in. If you're watching this on my YouTube channel, I'd love for you to subscribe and share. And I hope that everyone has a wonderful weekend. Hopefully the sun's going to stay shining. It's so nice to see the sun shining today. And I hope you all have a wonderful, blessed weekend.